Ever wonder why we're told not to eat too many sweets? We grew up being told this repetitively, but what is the theory behind it? Well, when we eat too much sugar, high glucose levels accumulate within our bloodstream. Over time, our bodies become resistant to a hormone called insulin, which helps us move glucose into our cells to make energy and allow for normal body functioning. This causes a condition called type 2 diabetes mellitus. This condition is characterized by systemic resistance of the body to normal effects of insulin, resulting in the pancreas gradually losing the ability to produce enough insulin. The pancreas, being the predominant organ involved in the pathophysiology of type 2 diabetes mellitus, overproduces insulin to compensate for the lack of glucose uptake into our cells. Over time, the pancreas is unable to keep up with the increased demand, and the insulin-producing cells of this organ begin to degenerate, resulting in insufficient amounts of insulin. As cells peripherally do not respond to the hormone, blood sugar levels become increasingly more difficult to manage. There are several risk factors which can increase the likelihood of the onset of type 2 diabetes mellitus, including but not limited to a prior family history of diabetes, obesity, inactivity, being over the age of 45, and a high blood pressure. Diabetics can experience symptoms such as frequent urination, increased thirst and hunger, fatigue, having slow healing cuts, and frequent infections. Did you know that the mouth can harbor the first signs of diabetes? Symptoms such as bad breath, a bad taste in your mouth, a dry mouth, and bleeding gums are oral-specific signs which can indicate diabetes in a patient. Diabetes can manifest in the oral cavity as periodontitis, dental caries, loss of teeth, and yeast infections. Periodontitis is a common side effect presented in diabetic patients. When there is an accumulation of food and bacteria on your teeth, it leads to plaque formation near your gums and in turn irritates this soft tissue. The inflammation and bleeding of the gums as a byproduct of plaque development is called gingivitis. Advanced gingivitis can lead to periodontitis. In conjunction to inflammation and bleeding to the gums, periodontitis causes damage to underlying bone and the supporting teeth. High levels of glucose facilitate such infections as well as dental caries development. This is because high sugar levels create a desirable environment for bacteria to grow in. The weakening of the underlying bone as a result of periodontitis can cause teeth to become loose and fall off. Furthermore, the increased glucose content in the saliva of diabetic individuals can aid the development of fungal infections such as candidiasis in the mouth. Other pathophysiological problems associated with type 2 diabetes mellitus includes an increased risk of cardiovascular disease, which is the damage to the heart and blood vessels causing strokes and a high blood pressure, diabetic retinopathy, which can cause a loss of vision and cataracts, kidney disease, which is the impaired kidney function due to an inability to clean the blood properly, and neuropathy, which is the damage to microvascular structures causing an inability for blood to supply nerves, causing nerve damage. So, how do we tackle the onset of type 2 diabetes mellitus? We have to remember that prevention is better than management or treatment. The Australian Dietary Guidelines recommends that in order to maintain a healthy lifestyle and prevent obesity, women aged between 19 to 50 should consume a minimum of 5 serves of vegetables per day, and men of the same age range should consume 6 serves of vegetables per day. Similarly, for men and women aged between 19 to 50, 6 and 4 serves of grains should be consumed every day respectively to meet the necessary nutritional requirements. Free sugar intake should be 50 grams or 12 teaspoons per day for adults with a healthy body mass index. Treatments for type 2 diabetes mellitus can be either pharmacological or lifestyle interventions. Pharmacological treatments such as metformin reduce the amount of glucose in the blood, limiting sugar absorption in the intestines and sugar production in the liver. Incretin-based therapies are also used to treat type 2 diabetes as they increase insulin release after food intake. Lifestyle interventions to facilitate the management of type 2 diabetes mellitus include regularly exercising and dieting to aim for a 5 to 10% weight loss. Regular blood glucose monitoring tests should be conducted to help manage blood glucose levels. Whether you've been directly affected by type 2 diabetes or have a loved one which experiences this condition, it is imperative for us all to understand the features and preventions associated with this disease. Type 2 diabetes mellitus has caused a substantial threat to the well-being of our society, and together we can reduce its incidence through healthy living.